Welcome to the Injury to Recovery YouTube channel. My name is Greg, this is Blaine. In the last video, we talked about how we could prevent ACL tears. What are we talking about today?
Today we'll talk about if the ACL tear has occurred and you have to have surgery. We'll talk a little bit about what that looks like.
Okay, so as I mentioned in the last video, had a family member, she had an ACL tear just recently. Pretty painful. We're actually considering weighing options right now. From what you said last week, you talked about how it's pretty painful with an ACL tear that's complete, but then it subsides pretty quickly.
Generally speaking, yes. One thing to mention also is that ACL tears actually pretty rarely happen solely ACL tear, so it's also very common to tear your MCL, which is a ligament on the inside of your knee, or your meniscus during an ACL tear. So if there's some damage to those structures, then that can also cause some pain. But if it's just a pure ACL tear, then usually the pain does subside fairly quickly.
Yeah, I don't think that's the case with her, but oh well. Well, hopefully we can get her back to recovery with this exact set of videos. I'm looking forward to it.
Okay.
So what do you want to talk about when we think about surgery?
So I just wanted to take a couple minutes and talk about what surgery entails. So it's completed by an orthopedic surgeon, and they have gotten better over the years. I've been a physical therapist for 11 years, and I've seen rehab get a little bit better over the past decade. And so they can take the ligaments from several different areas to reconstruct the ACL. So they used to do a lot of hamstring grafts where they take a ligament out of your hamstrings in the back, or they can do a patellar tendon graft of your patellar tendon there under your kneecap. And then more recently I've seen them do a lot more like quadricep tendon grafts, and if I tore my ACL, that's probably what I would go for, just based on all the ACLs that I've rehabbed. They seem to just do better. But it's a same-day surgery. And they take the grafts. They can also take a graft from a cadaver as an option. I don't see that happening as often nowadays as what they used to do. But they do it arthroscopically, so the nice thing is they don't have to cut you wide open like they did 30 years ago. And they put in the new ACL graft and anchor it in there. And it's usually quite painful for a couple of weeks, up to a month, just to put it bluntly. There's a lot of limping. You're probably going to be on crutches and be in a knee brace for a few weeks. And it's usually around 4 to 6 weeks after surgery where you start to walk normally and not to hurt so much and start to get back to life as normal. And ACL tears they can be fairly devastating just because for youth athletes, I mean, it's a whole year out of their athlete career. And so if you're, a 15-year-old high school athlete in sports all your life, to take a whole year away is just devastating.
Or a senior, and you're looking at scholarships like we were talking about last time, where parents are saying, hey, we want to get them into some sort of professional sport or college sports program. That can be really, really devastating, really concerning.
It really is. And for a lot of them, it's almost like taking their identity away when they tear their ACL and take their sports away. But it is, for athletes, it generally is a full year. It's 9 to 12 months before they can return to sports, and that's based on safety. If they return much sooner than that, even if they feel capable of it, their chances of re-tearing the ACL are very high. And so waiting a full year to return to sports is generally the safe thing to do. Again, I've seen athletes be returning a little bit earlier than they used to, getting more to like the 9 months rather than 12 months. But
is that based on the graft that you said?
Yeah.
It was the hamstring that you preferred, or that you saw?
I prefer the quadricep tendon grafts.
The quadricep tendon. Okay.
Yeah, but those tend to be best for athletes.
Mm-hmm.
And so that's because when they put the graft in, the strength of that graft is originally very strong, and then the strength of the graft just plummets for the first 6 weeks after surgery.
Yeah.
I don't really know why. But then after 6 weeks, your body kind of adapts to it, and it starts to heal. And all of that strength loss of those 6 weeks, it turns around and it starts to gradually rebuild, but it takes a full year for that graft to get to full strength.
Yeah, so if you do get into surgery, I'm guessing you don't want to get into that point where you're doing some of those prevention exercises that we did last week, or in the last video.
Right, yeah. Eventually, way down the road before you get back to sports, you do want to get into them, but that's several months after surgery that you do those high-level exercises.
So, with my family member, not an athlete, but we should probably expect about a year before she's back to normal, right?
Yeah, and for normal activities of daily living, I mean, she'll be back to normal probably within 2 or 3 months,
Okay.
where her life will probably be quite normal. But yeah, if she wants to go skiing or kick a soccer ball or something, it's a full year.
Okay. Good to know.
I guess the last thing I would mention is a neat tool. This is kind of a new technology development. Is one thing that does help for ACL tears, both before and after the surgery. And it's called blood flow restriction training. And so I think you've had a little bit of experience with that.
I have. You want me to talk about it?
Yeah, go ahead.
Okay, so my experience with blood flow restrictive training is I had somebody, it was actually at Fort Meade, and they went ahead and they took they put almost
It's like a tourniquet.
almost on my leg, and they had me do all of these exercises that you would normally do in a physical therapy clinic with that restriction on that leg. And so even if I was doing a squat with both legs, there was a whole lot more pressure on that leg that was being restricted on that blood flow. And I was not sure how quickly it would respond, and you probably know the data better than I do, but I was surprised at how quickly my muscles were able to build under those circumstances.
Yeah, and so that is correct. And so the tourniquet, it restricts blood flow. It doesn't occlude it completely, but it makes it so there's not as much blood going to your muscles while you're exercising. And so your muscle perceives that as a much more challenging activity than what it really is. And it triggers a physiological response. There's growth hormones and stuff that happens that it actually allows your muscles to build more quickly. So we use that a lot in ACL tear patients, both before and after surgery, because one of the biggest challenge after an ACL tear and surgery is muscle atrophy in your quads and in your hamstrings, but mostly in your quads. And so we can put that tourniquet on your thigh and have you start doing exercises, and they can be very simple exercises they don't put stress on your knee. And it's kind of a biohack. We're kind of cheating a little bit, but it allows you to keep your muscles strong without straining your knee. And so there's actually pretty good data that victims of ACL tears that use blood flow restriction training have less muscle atrophy and quicker return to activity than people that don't use it. So it's a fun tool that really didn't exist a decade ago, but now we have it.
Oh man, it was amazing how quickly that helped. So I was pretty surprised by that. So cool.
So yeah, we'll talk about that in a future video, probably maybe demo it a little bit.
Oh yeah, you just want to pick on me, that's what it is.
Here's our guinea pig here.
That's right. Awesome. Well, we'll catch you in the next video, and I think next video we're going to be talking a little bit about
that rehabilitation. So what does your rehab look like after ACL reconstruction surgery?
Awesome. We'll catch you in the next one. Thanks.